Hey, in this video, we're going to talk about Ketoconazole Shampoo, where it is, how it works, the problem it solves, and how you can use it to help you combat hair loss. So jumping into the whiteboard, let's start by looking at the problem that ketoconazole solves. So our scalps have their own microbiome. Our scalps are home to hundreds of billions of different microorganisms, things like yeast, fungi, and bacteria, and these are actually good for us. And that's because these microorganisms can feed off of dead skin cells on our scalp and sebum, which is the oil produced by our sebaceous glands. And in turn, these microorganisms can help regulate things like our scalp pH, sebum production, and can also help regulate certain pathways involving the metabolism of certain proteins and nutrients related to the hair growth cycle. So overall, this is a good thing. The problem arises when we have excess proliferation of some of these microorganisms or when we get the wrong strains or kinds of microorganisms. And this is a problem because this can lead to excess inflammation, which we know can accelerate hair thinning and hair shedding. So let's look at C. acnes as an example. C. acnes, which by the way used to be called P. acnes or Propionibacterium acnes, which is the dominant bacteria in sebaceous-rich skin. And so we know that we have sebum on our scalp secreted by our sebaceous glands, and this can feed C. acnes, which can in turn release porphyrins. And this is actually not a problem in low quantities, but excess porphyrins can be inflammatory and cause damage to our scalp microenvironment. So in high quantities, C. acnes can colonize the sebaceous ducts. This gives them direct access to their food source, and porphyrins react with UV light to trigger inflammation. As a result to inflammation, our body produces more sebum, which only feeds more P. acnes or C. acnes proliferation. So we have a little bit of a feedback loop going on here, where we have more inflammation leads to more microorganism overgrowth, which in turn leads to more inflammation. And so we can see from this study that porphyrins are more likely to be found in people with androgenic alopecia compared to individuals without androgenic alopecia. And so bacterial porphyrins can be inflammatory. And now let's look at a second example before talking about ketoconazole, and that's Malassezia. So Malassezia is a yeast that's found on everyone's skin and scalp, and it's perfectly natural. And once again, we have sebum on our scalp, which feeds Malassezia, which can lead to the release of inflammatory byproducts. So we have a very similar chain of events going on. And we can see from this study that metabolites of Malassezia infiltrate the epidermal barrier, leading to an inflammatory response. And as a result, more Malassezia and its byproducts are able to penetrate the epidermis, resulting in a continuous cycle of inflammation. So once again, we have that feedback loop leading to inflammation, which again, we know can impact hair shedding, hair thinning, and also dandruff. So this is where ketoconazole comes in. So ketoconazole is an antifungal medication, which is also known by its brand name Nizoral. And there's also some evidence to suggest that ketoconazole has antimicrobial and anti-androgenic effects. So ketoconazole is used to treat issues like dandruff, seborrheic dermatitis, jock itch, athlete's foot, and obviously hair loss. So ketoconazole comes in tablets, creams, foams, ointments, shampoos. In the context of hair loss, the delivery vehicle is always 2% ketoconazole shampoo. And we never really hear of ketoconazole being administered in oral form. And that's because of reports of liver damage associated with the oral form, which has in fact led to this being withdrawn in many countries. And all studies and reports on hair growth are carried out with shampoo version, which is well tolerated. So how does ketoconazole actually work? So we know that ketoconazole is an antifungal medication. So if we look at a fungal cell, and specifically if we look at the cell membrane, we can see that the cell membrane contains these molecules called ergosterol. And ergosterol is key for fungal cell membrane integrity. And so what ketoconazole does is it kills fungal cells by targeting ergosterol. Ketoconazole inhibits the synthesis of ergosterol, an important component of fungal cell membrane. And so with the application of ketoconazole, this prevents the synthesis of ergosterol, which completely destroys the integrity of the cell membrane. The cell membrane collapses, the cell contents leak out, and the cell dies. So fungal cell plus ketoconazole pretty much leads to cell death. So some reports also suggest that ketoconazole can be antibacterial, making it behave as a broad spectrum antimicrobial. And so here we can see that ketoconazole on the skin of animals infected with living bacteria was superior to that of steroid therapy, which suggests some antibacterial effect of topically applied ketoconazole. So it goes without saying that ketoconazole shampoo works way better for some people compared to other people. And that's because not everyone affected by pattern baldness will have these microorganism overgrowths. And so ketoconazole tends to work better for people with pattern baldness and also atopic or seborrheic dermatitis. And if you have pattern hair loss and also have lots of dandruff, skin flaking, seborrheic dermatitis, it is more likely that you will respond to ketoconazole favorably compared to hair loss sufferers without any of these skin flaking conditions. Some reports also suggest that ketoconazole may have some anti-androgenic effects. This is debated within the scientific community, but we can see from this study that ketoconazole has been shown to bind to human androgen receptors. Thus, the effect of ketoconazole on DHT pathway may be twofold: inhibition of DHT and or inhibition of DHT binding to the androgen receptor. So we know that testosterone gets 5-alpha reduced into 5-alpha dihydrotestosterone, or DHT, and we can see this happening inside of hair follicle cells. So testosterone diffuses through the cell membrane, it gets converted into DHT, it binds to the androgen receptor, and this can cause the cells to secrete signaling proteins that are associated with hair follicle miniaturization. And so let's look at some clinical data to be able to determine whether ketoconazole actually makes a difference in a clinical setting. So there's actually a bunch of different studies carried out on ketoconazole shampoo. We're just going to look at one of these today. So this study was conducted on 39 men with androgenic alopecia, and none of them had dandruff in the prior 6 months. So 27 men used 2% ketoconazole shampoo 2 to 4 times per week over a 21-month period, and 12 patients were used as control, and they used an unmedicated shampoo in a similar way. And so we can see from this chart that over a 21-month period, the unmedicated group continued to experience hair loss, as we can see from the decline in pylori index. On the other hand, the ketoconazole group experienced an increase in pylori index, which, by the way, is just the proportion of hairs in the anagen phase of the hair growth cycle, which is the growth phase of the hair cycle, multiplied by the average diameter of the hair shafts. And this study showed that ketoconazole can result in a greater proportion of hairs in the anagen phase, which is a good thing, increased hair diameter, a reduction in sebum production, and an increase in hair density after 6 months. Unfortunately for us, there are no before and after pictures, but the data is pretty favorable nonetheless. So when it comes to side effects of the topically applied ketoconazole shampoo, there seems to be no significant side effects. Some reports do include scalp dryness and itching, but it is generally well tolerated at a 2% concentration in shampoo form. So if you enjoyed this video, please subscribe, and I hope you enjoyed it, and I'll see you in the next one.